Dr. Jamerson Holloway, and in this presentation I will discuss why cultural competency training in nursing and the healthcare profession is necessary to provide culturally appropriate care to the patients we serve. Let's get started. What is cultural competence? Cultural competence is the ability of an individual to understand and respect values, attitudes, beliefs, and morals that differ across cultures, and to consider and respond appropriately to these differences in planning, implementing, and evaluating health education and promotion programs and interventions. Why is cultural competence important? Cultural competence is important because in Nevada, it's the law. Nevada Revised Statute number 449.103 stipulates regulations requiring training relating specifically to cultural competency for any agent or employee of a facility. The nurse swears an oath to abide by the Code of Ethics, and provision number 1 stipulates the nurse practices with compassion and respect for the inherent dignity, worth, and unique attributes of every person. The Nevada State Board of Nursing regulates the cultural competency licensure requirements, and for each person licensed, pursuant to this chapter, one or more courses of instruction that provide at least 4 hours of instruction relating to cultural competency and diversity, equity, and inclusion to be completed biannually. Cultural competency training must address persons of different cultural backgrounds, including, without limitations, persons from various gender, racial, and ethnic backgrounds. Cultural competency training must address persons from various religious backgrounds. Cultural competence training is all-inclusive and must address individuals identifying as lesbian, gay, bisexual, transgender, and questioning persons. Cultural considerations must be taken into account when it comes to children and senior citizens. Cultural competency training must address the specific needs of our veteran population. It is important that healthcare professionals understand and increase their knowledge of the veteran culture. This understanding is important to address the unique circumstances and healthcare issues associated with our veteran population. Cultural competence awareness has a direct influence on patient mental health, mental illness, and patterns of health utilization. Cultural competency training must address those persons with intellectual disabilities, developmental disabilities, or physical disability. It is important to mention that cultural competency training must address those individuals with addictions. Cultural competency training must address those persons who are part of any other population, such as obesity, homeless, and those suffering from depression and anxiety. It is important to be aware of implicit bias, unintended bias, hidden perceptions, and unconscious attitudes. Unintentional bias or implicit bias can negatively impact nursing care, conducive to poor communication and contributing to provider mistrust and decreased patient satisfaction. Implicit bias in nursing creates subtle discriminatory behaviors that compromise patient care outcomes. The Nevada State Board of Nursing has provided approved courses for cultural competency training for health facilities. Simply scan the QR code provided to gain access to the approved courses list. The Nevada State Board of Nursing also offers a free Cultural Competency course. Simply visit nevadanursingboard.org for more details. The health of everyone matters. The healthcare industry can decrease healthcare disparity, increase patient satisfaction, improve patient outcomes, and reduce healthcare costs by training healthcare professionals to incorporate cultural competence into practice. Cultural competency training allows us to tap into the immense power of our diversity, unlocking the cultivating culture of inclusivity. I am Dr. Jamerson Holloway, and I would like to thank you for listening. I would encourage you, if you have questions, to visit nevadanursingboard.org.